So we are getting lots of questions from parents about whether their child needs to have their MMR booster shot earlier than we would typically give it at the 4-year-old visit. So the children who are between a year and 4 years when they've had one dose of the vaccine but not a second dose. So in general, it is not necessary to give a second dose early, but there may be some special situations where your doctor and you would decide to do so. Most of those would be if there was a direct exposure in your school, in your daycare, in your family, something like that where we thought that the child would benefit from getting their immunity boosted early. But most kids who've had their first dose are going to be protected. And of course, common sense rules. You know, if you're going to a situation where potentially there's a lot of sick kids, you may choose to not go to that situation. You're definitely going to make sure your children are washing their hands, not being around kids who are coughing and sneezing, things like that. If parents have questions about measles, what measles is, what are the symptoms, the best resource would be for you to talk with the doctor or nurse at your doctor's office as to what those symptoms are, what your questions would be. There's lots of information on the internet that may be very scary to parents and may not be completely accurate and may make people more nervous or anxious. So your doctor really is your best resource for what is best for your child, because they know your family, they know your child, and so those kinds of calls should really be directed directly to your doctor's office.